So the idea is that we essentially have these really tiny parcel packages, delivery vehicles, that allow us to maybe deliver, some of the most sensitive labile, but also maybe some of the most toxic agents, but bringing them directly to the tissue where they need to be to ensure that they only act onto the diseased tissue.
Right.
Particularly interesting, for example, in cancer therapy, where people can have a lot of side effects from chemotherapeutics. But if we were able to take those toxic molecules and bring them only to the tumor, almost like a radiation where you try to only precisely damage the tumor tissue, I think a lot of tumor medications would become A, more effective, and B, potentially also better tolerated. And so we're really enthusiastic about these nanoparticles because we think they could enable this, safer, more effective delivery of a lot of different medications, both things that are currently already out in the market, things that are currently in development. And sometimes I go out on a limb and say, I wonder how many medications there are that actually have failed a clinical trial because they had too many side effects. They weren't effective enough.
Right.
But if we would have a tool to directly bring them to the diseased tissue, would that enable us to, take all these medicines that have failed and revive them to make them accessible for patients and for doctors?